Eastern Cape Premier Oscar Mabuyane has visited private hospitals belonging to the Life Healthcare Group in East London. This comes after authorities received complaints from workers and patients at the facilities. The visit was part of the Premier's ongoing monitoring of hospitals to check compliance to COVID-19 protocols. SABC News reporter Abongile Jantjies spoke with the Premier.
There's been a lot of issues out in the public, covered by the media, a lot of complaints that have been forwarded to us. Even yesterday, I still received a lot. Even whilst I was on quarantine, I've been interacting a lot with what has been coming out of the challenges that people are experiencing in these private hospitals. We convened from the very start, at the very early stages of this, we convened a meeting which was chaired by me, where we called the private healthcare space here in East London or Eastern Cape. Unfortunately, the life grouping was not available for that meeting, where we were trying to say how do we work together from the start. When we realized that then there were a couple of patients that would be admitted here and be discharged. As they were discharged, they were not really following our quarantine or our isolation protocols. This is where our concern came in from the start. It looks like the situation continued, and there's been a lot of allegations flying around. So I'm just here to see myself what is it exactly that these people are saying out there. You'd understand our attitude and our approach on a number of things, that we must always seek the truth from facts. You must always balance whatever that is being said by people. Other people can easily make wild-based allegations. So you've got to come here. Remember, government is the authority on the licenses. It's us who are giving these private companies licenses. So if these companies cannot comply with conditions that we are attaching to the licenses, then they have a problem. And people who are coming here are people of this government. This government is for these people. So we can't just fold our arms and wait from a distance and say, no, it's a private sector. There's nothing like that. This is life. We're in a campaign to save lives. We're here to make sure that everyone plays according to the rules of the game.
Should there be any discrepancies, Premier, what action can be taken, what action can be expected from government should there be any discrepancies or not following your regulations, since this will surely increase in the numbers? It will have a negative impact in your fight against COVID-19.
I don't think you would want me to really preempt the discussions that we'll have and whatever that we'll be able to see. But where there's a wrongdoing, generally, there must be consequences. So we'll definitely want to make it a point that in our fight, in our campaign to save lives, we are able to take full responsibility on that. And the private sector is very key, is very critical into that space. It has been serving our people very well. Even now, we would want them to still to play at that position. So, but if there is something that is not going right, I can tell you, we can't really put our heads in the sand. We can't really adopt an ostrich approach on such matters. We've got to confront them. There's been a lot of complaints, people raising issues that even workers here, they must not disclose that they are positive. These people are integrated in the society. These people who are discharged in this hospital, they go back. All the sad stories that we have heard about St. Mary's in Mthatha, which is part of life, those are really disgusting. You can't have a leadership of government coming to visit and people disappear and the CEO runs away or doesn't care about what's going on. This is the life, and most of these lives that are here, it's a black life, and that black life matters.
Premier, we're on level 3 now, and since level 3 kicked in and there's been the sale of alcohol, you've been campaigning that there should be a ban on alcohol. The health system is pretty fragile now since level 3. You've been criticized for your call to ban alcohol. What can you say about that?
Who has criticized me?
The private sector, businesses. They say that you are not. Well,
the private sector is in business. We are interested in that business. While we are working on saving lives, we are also interested on the livelihood of our people. Yes, we know liquor plays a huge part in our economic activities, and we really appreciate that. They're creating jobs. They're also, but we are saying we can't continue as a business as usual when we see a lot of things. Our health care system is feeling the heat. Just from the 1st of June to the 7th, the stats tells you on what is going on, what's happening there. We don't have a problem with liquor. liquor generally is not a problem. But liquor is a problem immediately it is consumed by someone who is irresponsible. We've got a problem with irresponsible people who are drinking or who are consuming liquor and take their car keys, get into the road and commit these fatalities that we see. So we can't. We had a very peace in our hospitals since the lockdown until 1st of June. We started to have a problem of our trauma unit being actually overwhelmed by this. We've got one enemy now. Our enemy is not liquor. Our enemy is COVID-19. We want everyone to be sober for us to concentrate and focus on this war against. You can't be at war when you are not sober. So, and the regulations are clear. They are saying from Monday to Thursday until 5 you can buy liquor for your consumption at home. All what we see, people on the street, people celebrating this, is wrong. It's completely out of order. And we don't have to have police to monitor everyone who consumes liquor out there. We can't give ourselves unnecessary pressure, unnecessary problem. Our concern is about hospitals. These hospitals, we have decanted them to accommodate COVID-19 patients. That's what we focus on. Liquor will remain there. The economy will remain there. Yes, it will take some time to actually go back and is currently sluggish. But we can't sacrifice lives simply because we want the short-term happiness because of liquor.
Lastly, Premier, since both metros they are nearing 2,000 cases now each, can we expect you, if there was an opportunity to return to level 4 or 5, would you take that decision?
Well, that's a national decision. Even the ones that we're talking about of liquor were to make submission because the Command Council met. Part of its work in its meeting, analyzing and assessing challenges that we have, because we've got a clear rapid response strategy to contain virus. So even the issues of alert levels, they still talk to the behavior of the people. The challenge that we have, it's about the socio-cultural behavioral change that we need from our people. Whether we can be at alert level 1 or alert level 5, if people are not prepared to understand that we are in a very abnormal situation, and we are dealing with this phenomenon that we are all exposed to it for the first time, and things that we are seeing as well are not okay, and we've got to work together. Now we are at a point where each and every individual must take full responsibility about his or her life and protect his or her family for the society to be protected. So the issue of alert levels are neither here nor there. Yes, of course, there are certain activities that are allowed, but we can't cut Eastern Cape out. Eastern Cape must be part of South Africa, must be integrated. A business must be allowed. We have got a huge international investments that are here in East London and Port Elizabeth. Unfortunately, those two metros are provincial economic hubs. We just can't afford not to have them going back to ensure that they are integrated into the economic space. So that's a kind of a predicament that we are in.